Hey everyone, how's it going? It's been a while since I've done a video, so being that my official 1 year is Friday and last week I had my 1 year testing, I thought it'd be a good time to reach out to everyone again and just let them see that, for one, I'm still here and just kind of update them on how my progress has been going. The news overall from my visits last week was good and then a little ambiguous, so I'll start the good stuff first. From a lung numbers perspective, everything is looking good there. My lung numbers actually went up, and on my walk test, I walked 11 laps a couple months ago, and I did 14 and a half this visit, which was almost my all-time high since they've been following me. So on that front, that's still looking good. Um, my CT scan showed a little bit of inflammation or slash infection in my right lung. All the tests so far have been coming back negative, but I mean, I saw it. The doctor showed me on the scan, so it's something's there, but we still don't know exactly what or what's causing it. So they'll see me again in 2 months and repeat the scan. I possibly could have had a virus and not even realized it, and that's just left over. We really won't know until we scan again to see if it's still there. On my CT scan, the radiologist noted that it looks like my pulmonary valve or the artery going to the heart was thickening a little bit. And he mentioned sometimes that could indicate pulmonary hypertension, which I had a low grade form of it before transplant. As far as I know, that went away after I got new lungs, and this could be new. But when I was looking back at all my heart tests, they didn't check for it. So I don't have anything to compare it to, because on my heart ultrasound, it was noted that my pulmonary pressure was a little elevated. So cardiology was supposed to see me in September, but they're going to see me in August instead, just to make sure there's nothing new that needs to be treated or something that warrants further investigation. I don't feel really, I guess, any different than I've had the last, for sure, several months. So maybe it was an incidental finding, or maybe there was some other, the infection, whatever, maybe elevated it. I'm not exactly sure, but that'll be something to keep an eye on and just kind of watch and make sure it doesn't get out of control, because if pulmonary hypertension gets too out of control, that I've seen people that have to get lung transplants because of it, and I'd rather not already be having to discuss a retransplant if possible. So it's not super high elevation levels, but enough to where we need to take a look at it and see if there's anything to be done about it. But all in all, it was a good visit. They'll see me again in 2 months, and I won't have to do nearly the amount of tests I did this past time, just because I was for my 1 year follow up. They do a lot more testing. They probably took 15 to 20 vials of blood. It was the works, but I like having all that data, so it's fine as long as the needle sticks don't hurt too much. But lately, aside from health, I've just been focusing on work, just thinking about the future, what I want to be doing, and should I be somewhere else, or am I exactly where I need to be? It's been something my mind's been going back and forth with. It's a lot harder to think about things like the future when you're fighting for your life all the time, but now that that's been calmer, there is time to be like, am I doing all I should be? And that's just something I'm going to pray about and think about more as time goes on, and who knows what opportunities could be out there. But it's nice for a change, being able to think about the future and not having to worry so much about, am I going to be able to breathe today, and all that fun stuff. So I just, I guess, ask for continued prayers with that, like just peace about where the future is going to be, and that whatever these incidental findings on the testing, hopefully they're just one-time occurrences and it's nothing serious. But we'll find out in the coming months, and then we'll just have to go from there. Well, thank you for listening. Um, Glad I got to reach out to y'all again, and because I know a lot of people will ask or to ask my dad how I'm doing, so you get to see I'm still doing good. Just trying my best to stay healthy and just enjoying life. I'll talk to y'all later. Bye.